Picture this scenario, right? It is 3:00 a.m. The house is completely quiet. Everyone else is fast asleep, but you are wide awake.
Oh, the worst
It
feeling.
really is. And you're awake because the right side of your lower jaw is suddenly throbbing. It's almost as if it has grown a heartbeat of its own. Just this deep, agonizing, radiating pain that seemingly came out of absolutely nowhere. Or, consider a completely different scenario.
Okay, what's the second one?
It's a beautiful Saturday afternoon. You're playing a casual game of touch footy in the park. Someone's elbow goes a little wild, and suddenly you are staring down at a jagged piece of your own front tooth just resting right there in the palm of your hand.
Oh, wow. Yeah, both of those scenarios
Yeah.
induce a very specific, deeply primal kind of panic, don't they?
Right.
I mean, the mouth is an incredibly sensitive area. It's just heavily wired with nerves that feed directly into our brain's threat detection centers.
Right.
So when something goes wrong in there, the alarm bells don't just ring, they absolutely deafen you.
It is terrifying because when a dental emergency strikes, it isn't just a matter of physical pain, is it? It immediately triggers this overwhelming, compounding anxiety.
Oh, absolutely.
You're hurting, you're looking in the bathroom mirror trying to pull your cheek back to see what's wrong, and you have absolutely no idea what the protocol is. I mean, we know what to do for a sprained ankle, we know what to do for a paper cut.
Yeah, standard first aid.
Exactly. But a sudden, severe toothache is like the human body's version of a check engine light flashing bright red on your dashboard. You have no idea if this is a minor glitch like maybe you just need to floss better, or if the entire engine is about to completely fail on the highway.
That is a perfect analogy, and the ambiguity of the situation rapidly accelerates the panic.
Yeah.
You are suddenly forced to make immediate medical and, let's be honest, financial decisions,
Right.
while your cognitive bandwidth is entirely consumed by managing acute pain.
Which brings us to the core mission of today's deep dive. We are going to decode that terrifying dental check engine light. We are looking at this highly practical, incredibly grounded guide designed specifically for families.
Right, the one from Mitchellton?
Yes, exactly. It originates from a clinic called My Gentle Dentist Brookside, located right in Mitchellton. And we are going to unpack their source material today to understand exactly what constitutes a true biological dental emergency.
And just as importantly, when you need to bypass the dentist entirely and head straight for a hospital.
Right. Plus, the fascinating mechanics of what is actually happening inside your head during these crises.
But before we even examine the biological mechanics of like a cracked tooth or a severe infection, we really need to look at the psychological lens this particular guide uses.
Oh, for sure.
Because the panic of a 3:00 a.m. toothache is almost always compounded by two secondary fears. You've got the physiological fear of the dental chair itself.
Which is huge for a lot of people.
Massive. Yeah. And then there's the vulnerability of being financially taken advantage of when you are just completely desperate for relief.
Oh, man, that fear that you are going to walk in needing a simple fix for a toothache and somehow walk out having been convinced to buy a $10,000 comprehensive smile makeover that you absolutely did not need.
Exactly. And when we look at the materials from My Gentle Dentist Brookside, there is this strict, highly intentional avoidance of exaggerated claims. I mean, you won't find any flashy, 100% pain-free guarantees in their literature.
Right, none of that marketing fluff.
None of it. You won't see them claiming to be the absolute #1 best visionary dentist in the country or anything like that. The focus is entirely on providing realistic, reassuring, and practical care with an explicit emphasis on avoiding unnecessary treatments.
Which is actually really refreshing, because usually medical and dental marketing is just stuffed with superlatives. It's all guaranteed this and miracle that.
Oh, yeah, it's everywhere.
But by stripping away the flashy guarantees, it feels like they're acknowledging the complex, sometimes uncomfortable reality of human biology. I mean, no honest medical professional can truly guarantee you will never feel a single pinch or pressure during an extraction.
No, they can't. And honestly, in a state of panic, patients are highly vulnerable to manipulation. When you are in an 8 out of 10 pain state, your prefrontal cortex, which is the part of your brain responsible for complex decision-making and evaluating long-term consequences, is essentially compromised.
You're just operating on pure instinct.
Exactly. You are in what we call an amygdala hijack. You just want the pain to stop. So a clinic using fear-based language or over-promising absolute frictionless guarantees is often, whether they mean to or not, exploiting that lowered cognitive defense.
Wow, that's a really dark way to look at bad marketing, but it's so true.
It is. A practical, plain English approach focuses on realistic outcomes. It communicates that while dealing with biology can be, uncomfortable, the situation will be handled safely, conservatively, and without pushing unnecessary procedures.
Which actually builds way more trust.
Exactly. This approach actually regulates the patient's nervous system before they even make a phone call.
It totally de-escalates the crisis.
Yeah.
But speaking of crises, their guide does something critical right in the opening sections. It draws a massive, bright red line between a dental emergency and a medical emergency.
Yes. Knowing the difference between needing the dentist chair and needing the emergency room at a hospital is honestly the most vital triage skill you can have.
So what are the actual red flags the guide lists?
The guide lists some very specific ones: severe swelling, facial trauma, a fever, difficulty breathing, or difficulty swallowing.
Okay, I need to pause here because I am definitely guilty of minimizing these things. I mean, a fever is just a fever, right? We get fevers all the time from common colds. Why is a toothache accompanied by a fever or a bit of swelling that makes it hard to swallow suddenly a 9/11 situation?
Well, we have to look at the anatomy of the head and neck. A standard toothache is a localized issue, right? The
Yeah.
infection is trapped within the immediate area of the jawbone. A fever, however, indicates that the bacteria have broken out of that localized area and entered your systemic circulation.
Oh, wow. So it's not just in the tooth anymore.
Exactly. You are no longer dealing with a sick tooth. You are dealing with a whole body immune response to bacteremia, which can rapidly lead to sepsis.
So the bacteria are essentially using the bloodstream as a highway to the rest of the body.
That's a great way to put it. And the structural danger is even more immediate when we talk about difficulty swallowing or breathing.
Right, because that sounds terrifying.
It is. The spaces between the muscles in your neck, they're called fascial planes, are interconnected.
Oh,
If an infection from a lower molar escapes into these fascial spaces, the swelling can track downwards, rapidly filling the space under your tongue and down your neck.
down your neck, like on the inside.
Yes, on the inside. This condition, historically known as Ludwig's angina, can physically crush your trachea. The swelling physically pushes the tongue up and back, completely compromising the airway.
Oh my gosh, that is wild.
And this isn't something a dentist can fix with a drill in a clinic. It requires the multidisciplinary teams of a hospital, intravenous antibiotics, and potentially emergency airway management.
Okay, so let's go back to my previous analogy. A regular dental emergency is like a fire contained in your kitchen oven.
Hmm.
It is bad, you need the fire extinguisher right now, and you definitely need to handle it.
Right.
But the moment you have a fever or that swelling reaches your throat and restricts your breathing, the fire has breached the walls and is burning the structural supports of the house. You don't just grab the kitchen extinguisher anymore. You evacuate and call the fire department.
That's exactly it. When the structural integrity of the whole system is at risk, you bypass the local clinic. And the same applies to severe facial trauma.
Like from the touch footy accident we mentioned earlier.
Well, a broken tooth from an elbow is one thing. But if an accident misaligns your jaw or causes massive facial swelling, you are potentially dealing with complex bone fractures or even a traumatic brain injury.
Oh, right, because it's your head.
Exactly. A hospital has the necessary diagnostic imaging, like CT scans and neurology teams, to rule out a concussion before anyone even bothers looking at the broken teeth.
Okay, so let's say we have assessed our 3.00 a.m. situation. We take our temperature, and there's no fever. Our breathing is totally fine, and swallowing feels perfectly normal.
Good. We're out of the woods for a medical emergency.
Right. We have successfully ruled out the systemic medical crisis. The kitchen fire is contained to the oven. We are dealing with an actual localized dental emergency. The guide breaks these down into two categories. Let's start with the invisible emergencies. The ones you can't see, but you can undeniably feel.
Yeah, these internal emergencies are incredibly common. The guide specifically highlights severe toothaches, localized facial swelling that hasn't crossed that red line we just discussed, and severe wisdom tooth pain.
Now, here is where I really struggle with the concept of a dental emergency, because if I bruise my thigh muscle during a workout, or I get a minor cut on my arm, it gets inflamed, it hurts, but I just, take some ibuprofen, wait a few days, and my immune system rushes in to heal the tissue.
Right, the body heals itself.
Yeah. So why can't I just take Advil for a severe toothache, let the tooth swell, and let my immune system do its job? Why am I forced to go to a professional for a biological process I usually just tough out anywhere else on my body?
That is a really fantastic question. And the answer comes down to the mechanism of healing, which relies heavily on blood flow and physical space. This brings us to the unique anatomy of a human tooth.
Okay, break it down for me.
So, your thigh muscle is surrounded by flexible tissue. When you injure it, blood vessels dilate, white blood cells rush to the area, and the tissue physically expands outward to accommodate the swelling. The inflammation has somewhere to go.
Right, it gets puffy.
Exactly. A tooth, on the other hand, is a rigid, unyielding biological box.
Because of the enamel, right. I mean, it's like solid rock.
Yes. Enamel is actually the hardest substance in the human body, and beneath it lies the dentin, which is also a very hard, bone-like tissue. Trapped deep inside this impenetrable vault is the pulp.
And what's in the pulp?
The pulp is this tiny, delicate ecosystem of living tissue, highly sensitive nerves, and microscopic blood vessels. When decay finally breaches the enamel and the dentin and introduces bacteria into that pulp, the tissue becomes infected and inflamed.
But the inflammation has literally nowhere to expand.
Exactly. The rigid walls of the tooth do not yield a single millimeter. So as the pulp tries to swell, it drastically increases the hydrostatic pressure inside the tooth.
Oh, that sounds incredibly painful.
It is. That pressure brutally compresses the nerve against the hard dentin walls, generating that agonizing, throbbing pain that keeps you awake at night. But more importantly, that immense pressure physically crushes the tiny blood vessels entering the root tip.
Wait, so the swelling chokes off its own blood supply?
Yes. The inflammation effectively strangles the tooth's own blood flow.
But if the blood supply is crushed, the immune system's white blood cells can't even get into the tooth to fight the bacteria in the first place.
You've got it.
Okay.
The highway is entirely blocked. The immune system cannot access the infection. This is why toughing it out is biologically futile. The tissue inside the tooth will eventually undergo necrosis, meaning it will die.
Wow.
And once the tissue dies, the acute pain might temporarily stop, tricking you into thinking you are healed.
But you're definitely not healed.
Not at all. The bacteria continue to multiply in that dead space and will eventually push out of the root tip into the jawbone, creating a massive abscess. Severe pain in a dental context is an undeniable mechanical alarm bell.
Because a physical threshold has been crossed.
Exactly. A structural or infectious threshold has been breached, and professional physical intervention like a root canal to remove the dead tissue or an extraction is literally the only way to release that trapped pressure. It will never magically resolve on its own.
That structural reality makes the idea of ignoring a toothache seem not just stubborn, but genuinely dangerous. I mean, the biology is completely stacked against you.
It really is.
Well, we've covered the pain you can't see, caused by that trapped pressure. Now let's pivot to the damage you clearly can see, the structural disasters.
Yes. These are the emergencies that occur in a fraction of a second due to trauma or material failure.
The guide details several physical failures. So we're talking knocked out permanent teeth, broken or chipped teeth, and lost fillings or crowns. The overarching theme for these structural issues seems to be that they are incredibly time-sensitive.
Time is the ultimate enemy when dealing with physical dental trauma because we are, again, dealing with living cells.
Right. Let's look at the classic knocked out tooth.
Okay, when a permanent tooth is completely dislodged from the socket, the microscopic network of fibers that hold it in the jawbone, they're called the periodontal ligaments, are violently severed.
Wait, ligaments? I always assumed the tooth was just cemented solidly into the jawbone like a wooden post in concrete.
Most people do, but it is actually suspended by millions of tiny living elastic fibers that act as shock absorbers when you chew.
Oh, that makes so much sense.
Right. So when the tooth is knocked out, half of those living fibers stay in the socket and half remain attached to the root of the tooth that is now resting in your hand. If you get to a dentist quickly enough, there is a genuine window of opportunity for those severed fibers to reattach and heal, effectively saving the tooth.
But there's a catch, I'm assuming.
A big one. Those cells on the root are extremely fragile. They require a very specific osmotic balance to survive.
So if you just hold the dry tooth in your hand or wrap it in a tissue to bring to the clinic, what happens to those cells?
They rapidly desiccate. The moisture inside the cells evaporates, causing them to physically rupture and die within, say, 30 to 60 minutes.
That fast?
Yep. And once those periodontal ligament cells are dead, the body will reject the tooth even if a dentist perfectly reimplants it.
Oh, wow. So you have to keep it wet.
Exactly. This is why emergency guides, including this one from My Gentle Dentist Brookside, emphasize keeping the tooth moist. Placing it back in the socket is ideal, but if you can't do that, dropping it in a glass of milk is the next best option.
Milk, really?
Yes, milk. It has a very specific osmolarity and pH balance that closely mimics the body's natural fluids, so it keeps those fragile root cells alive during the rush to the clinic.
That is incredible. It is quite literally a race against cellular necrosis. Every single minute counts. But what about a structural failure that seems far less dramatic, right? Like losing a filling or a crown while eating a sticky piece of candy?
Oh, happens all the time.
Yeah, and a lot of people might not even experience immediate pain when that happens. So why is a lost piece of porcelain considered an urgent structural disaster on par with, dental trauma?
To understand the urgency there, we have to look beneath the surface of the tooth again.
Ooh.
Fillings and crowns are not just cosmetic, they are structural
Right,
seals.
they keep the bad stuff out.
Exactly. They protect the inner layer of the tooth, the dentin, from the incredibly harsh biome of the mouth. Dentin is not solid like enamel. Under a microscope, dentin is actually highly porous.
Porous, like a sponge.
Sort of. It is made up of millions of microscopic fluid-filled tubes called dentinal tubules. And those tubes lead directly down to the sensitive nerve in the center of the tooth.
Oh, I see where this is going. So when you lose a crown, you are exposing millions of tiny tunnels straight down to your nerve.
You are. Every time you breathe in cold air, drink hot coffee, or eat anything sugary, you are altering the fluid dynamics inside those microscopic tubes. The fluid shifts, which physically pulls on the nerve endings, triggering sharp, shocking pain.
That sounds awful.
It gets worse. The mouth is teeming with bacteria. Without that protective crown, the bacteria now have direct, unhindered access to the softer internal structure of the tooth. A tooth without its crown is highly susceptible to rapid aggressive decay or even sudden fracture from normal chewing forces because its structural integrity is totally compromised.
So it's like a damaged roof. You wouldn't wait until the next thunderstorm to patch a massive hole in your roof. You secure the structure immediately before the environment causes catastrophic internal damage.
That's a brilliant way to look at it.
Yeah.
You have to seal it back up.
All right, so we've established the complex biology and the undeniable urgency of these situations. We know what an invisible pressure emergency looks like, and we know the ticking clock of a structural disaster. Which leads us to the final, incredibly practical piece of the puzzle, localizing the solution.
Yes. This circles back to the specific context provided in our source material.
Right. The physical anchor of this guide is My Gentle Dentist Brookside, explicitly located at the Brookside Shopping Center in Mitchellton. And highlighting this geographical detail isn't just about reading the address for the sake of it, is it? It reveals a crucial strategy in emergency preparedness.
It really does. It all relates back to the psychological concept of cognitive load that we discussed earlier.
Right, the amygdala hijack.
Exactly. During a sudden crisis. So imagine your child trips on a concrete and shatters their front tooth. Your stress hormones immediately spike. Your cognitive bandwidth is completely maxed out just managing the immediate physical situation.
Right. You are trying to stop the bleeding, you are trying to soothe a screaming child, and your own heart is pounding out of your chest.
Exactly. You have absolutely zero mental capacity left for complex research.
Done.
In that state of acute distress, the absolute worst thing you can do is pull out your smartphone and begin frantically searching for an emergency dentist. You don't have the time or the focus to read through Google reviews, decipher various clinic philosophies to ensure that we'll treat your child gently, or try to navigate some unfamiliar map.
The cognitive demand is just way too high, which leads to panicked, suboptimal decisions. You end up going to the first place you see, regardless of their approach, just to make the crying stop.
Exactly. So the strategic value of this guide lies in what psychologists call pre-computation or preloading decisions. By identifying a specific local option before you ever actually need it, you bypass the entire decision-making phase during a crisis.
That makes total sense.
Right. If you live near Mitchellton and you have already vetted My Gentle Dentist Brookside, you know they're located inside a recognizable, easy-to-navigate community hub like the Brookside Shopping Center. You know their clinical philosophy is grounded, practical, and avoids aggressive upselling.
So when the child breaks their tooth, the plan is already solidified in your mind. You don't have to think. You simply grab your keys and execute the plan.
Exactly. The psychological reassurance of that preparedness is massive. It takes a huge, chaotic variable completely out of the equation. Just knowing exactly where to go, knowing the route, and knowing the type of care you will receive brings the panic levels down enough so you can actually focus on safely getting there.
Preparedness is basically the ultimate mechanism for regulating a panicked nervous system. Well, let's distill the core insights from our journey through this guide today. We started by examining the deep psychological anxiety surrounding dental care and how avoiding flashy, unrealistic guarantees signals a more grounded, trustworthy approach to patient vulnerability.
And then we identified that vital anatomical red line. We learned how interconnected fascial spaces and the bloodstream mean that a fever, swelling, or restricted airways elevate a localized tooth issue into a life-threatening systemic crisis requiring a hospital.
That Ludwig's angina stuff is going to stay with me for a while. Then we dove into the rigid biological box of the tooth, discovering why inflammation strangles the blood supply and makes toughing out a toothache physiologically impossible.
And we explored the structural ticking clock, from the microscopic living cells on a knocked-out tooth needing the specific osmolarity of milk to the fluid dynamics of exposed dentin when a crown is lost.
Finally, we analyzed the psychology of cognitive load, demonstrating why pre-computing your emergency plan and knowing the exact location of a grounded local clinic drastically reduces the chaos of a sudden crisis. So, if you are listening to this deep dive and you happen to be near Mitchellton, the smartest move you can make is to proactively contact My Gentle Dentist Brookside.
Highly recommend it.
Reach out, check their availability, or simply save their contact information in your phone right now, long before you are in the throes of an urgent, painful concern. Preloading that decision is an incredible favor to your future self.
It really is. You know, the overarching theme of this entire guide points to a fascinating disconnect in how we view our own anatomy.
How so?
Well, we routinely treat our teeth as if they're somehow entirely separate from the rest of our biological system. We dismiss their warning signs, those little twinges of sensitivity or dull aches, until they escalate into an undeniable, agonizing crisis in the middle of the night.
That's so true. We just ignore it until we can't.
Right? So how would our overall health and our peace of mind fundamentally transform if we began analyzing a subtle, lingering twinge in our tooth with the exact same proactive caution and urgency that we naturally apply to a strange heartbeat or a sudden unexplained shortness of breath?